Hello, everybody. Richard Sloggett here from the Politics of Health Substack. Wanted to do just a short presentation on some of the developments in health policy last week. Some of these may have been crowded out a little bit by the Mandelson scandal, but I thought it was an important week in health policy to look at this concept of the disconnect between the government and the political messaging, and how the government sees the NHS and how the public and voters themselves are seeing it, and the role of the media within it. This political reality, media reality, and what the adapted cartoon at the top calls real reality. So this is what the government wants to talk about, and what it wanted to talk about over the last sort of couple of weeks. It wants to talk about the reductions in the waiting list, and I've reproduced the government's own graphic with a slightly interesting y-axis here to show that fall in the elective waiting list, getting backbench MPs such as Dawn Butler to go out and show how queues are being reduced to access services. Big focus last week was obviously on the cancer plan, and I've talked in a different Substack post about how that plan was sort of chunked up and pushed out to different voter groups, and all the different announcements packaged up, and how the government's journey on that plan has completely changed from being sceptical to being kind of quite strong advocates and seeing it as a political opportunity. And then even as we've moved into the weekend, and pressure on the Prime Minister has obviously been growing, MPs, ministers coming out in support of the Prime Minister, often talking about the achievements of the government, talking about the increase in spending and the increased investment going into the NHS. And I've just highlighted the one here from Stephen Kinnock. This is what the government wants to be focusing on: reductions in the waiting list, investment in cancer services, and general investment in the NHS. But last week, I thought there was a really interesting kind of shift in the media landscape on health policy. Obviously, there's been pieces running throughout the winter, particularly on corridor care and strong public concerns about that. But last week, we saw a series of pieces that dropped that very much challenged and ran very counter to the government's own narrative and approach in quite a worrying way, I would say, if I was working in the government currently. So it started off the sort of top of last week with news that emerging that Labour was paying NHS trusts money to remove patients from the waiting list. Then there was a story in the middle of the week that analysis done by the Health Foundation showing that people who've been sent into particular trusts to help drive down waiting lists, particularly in deprived areas, had not had the impact that was being spun by the government, and instead, again, people were being removed from the waiting list rather than seeing an increase in treatment. The cancer plan itself, which had a long runway of comms up to it, landed and then suddenly had to jar up against the reality, some pieces that set out the reality of cancer services on the ground. Rebecca Thomas's piece at the top here in the Independent, I thought, was particularly strong. She's done a special report on cancer services, which is well worth a look in the Independent, and some of the challenges that those services face. We also saw pieces in the Guardian on hiring bans in cancer units and postcode lotteries and access to radiotherapy. So the cancer plan itself ran up against the reality on the ground that services are facing. And then as we went into the weekend, we had the Sunday Times, Sean Linton's piece in the Sunday Times saying that hospitals are cancelling their operations to save the NHS money at the end of the financial year. And as we bled into this current week, we've also seen a story about postcode lottery on access to IVF in the NHS, long-standing challenges around patients not being able to access the number of cycles that they should do according to NICE guidelines, but an update based again on spending pressures and spending challenges. So the reality that the government wants to push, the messages it wants to push around investment, reductions in waiting lists, new cancer plan, run very strongly up against this reality on the ground of how services are performing and where some of the pressure points are. And I think this disconnect between what the government is pushing and what the reality patients are facing on the ground, and how some of the media is now reporting that, is really starting to cut through, and is really hurting the government. It's hurting the government not only at the national level and its overall polling ratings and polling data. If you go back to when Labour was elected, obviously I think they got 34% of the vote at the last election. They are now on low 20s, high teens, so they've lost about a third or so of their vote, and are now sort of significantly behind Reform UK on a consistent basis in the polls. And one of the underreported elements of that drop is Labour has lost its lead on health and the NHS, and it's lost its lead in, depending on where you look at it, either completely. So if you look at the Mori data from last November, which shows an amazing shift that Reform UK was now the party most trusted on health, and there was only one other data point that was ever taken way back in the 1970s that had Labour behind the Tories. So that is a major shift. And if you go to the most recent data from YouGov, which asks questions specifically including the words National Health Service, Labour does have a lead, but only 19% think it has the best policies versus 13% for the Conservatives, and I think it's 11 for Reform. So that is a very narrow gap. So the part of the collapse in Labour's poll ratings, part of the pressures on the Prime Minister are to do with the fact that the public has lost confidence and has lost trust in Labour to be the most trusted party on the NHS. It desperately needs to get that moving in a more positive direction. And I wanted to conclude this short presentation today by sort of saying, well, what can the government do about it? I think the first thing to do is you've got to acknowledge there's a problem. And this is not a comms messaging problem alone. This is also a policy problem. I think the part of the issue here is that the policy framework is unclear, it's incoherent, it points in different directions. We didn't get that clarity that we really needed out of the 10-year health plan, and the comms is therefore struggling to kind of communicate what the government wants to achieve. I also think that the government needs to sort of move on from some of the messaging and approaches that it's taken in the first 18 months in office. Talking about record levels of investment when that's come from a very unpopular tax rise is unlikely to really cut the mustard. The waiting list, talking about small reductions in big numbers in the waiting list, didn't work for Rishi Sunak. It probably won't work for Labour either. 10-year health plans feel far too far off. 3 shifts feel too abstract, and big targets around 3 and 4 patients will survive cancer, whilst welcome, are seemingly detached from the reality that the patients are facing. It all feels to me a little bit old world, and it's not landing. And I think that polling that I showed on the previous slide sort of reflects that. So what can the government start to do to move forward in a more positive direction? I think what it needs to do is it needs to try and distill its health reforms into an organised policy framework for change. Try and get it on one side of A4. What does the operating model, what does the policy framework look like? What is it trying to do? What is it trying to achieve? The public doesn't understand it. The broader health community is struggling to understand it. People in the NHS are struggling to understand it. We need far greater clarity around what the sort of approach that the government wants to take is on the back of the 10-year health plan and other investments. Then it needs to build a story about what it's trying to do. What's the elevator pitch? What are the priorities? Where did it start from? Where are you going? What are the trade-offs? Having that sort of rich, honest, but direction-setting type of conversation with energy and momentum. Alongside that, rebalance the focus, not just on the elective waiting list, but the public is more interested in GP access. It's more interested in A&E waiting times. Find those metrics of improvement and show how the reforms and the policy framework you're trying to get to can be achieved, are being achieved through delivering on some of these targets. Break down the investments that you're making into smaller chunks and demonstrate how they're benefiting particular voters in particular parts of the country. That, I think, was a success of the cancer plan. The government needs to be doing a lot more of it. The government also needs to think a lot about who are the best speakers and advocates for going out and supporting these plans. Politicians are not well trusted. They are not well liked at all. Building that cohort of people who will go out and go into bat for you, not just people who write a quote for you on a press release, is I think also something that comms-wise in particular needs to evolve. And from a comms perspective, then the grid, the DH grid, really focus in on those reforms, what you're trying to achieve, what benefits is it bringing. Try and crowd out some of the noise. Do not flood the zone. Do not focus on the peripheral stuff. Try and tell a new story about the change you're trying to make and where it is heading. So some hopefully constructive and helpful suggestions made there. And don't just take my word for it. Just landing as I was putting this together was this new research from Dominic Cummings, former number 10 lead special advisor on voter attitudes to a range of issues. And what I thought was most interesting, I haven't read the whole piece, so I'm going to do that very shortly, but Cummings on the NHS identifies this as his headline message. He says voters are much more sceptical that more money will help the NHS than in decades, maybe since the start of the NHS. Now, actually, Wes Streeting himself, when in opposition and even in government, has said that. But the key bit, I think, is this next sentence. They want to hear new ideas but hear nothing from the old system. So where are the new ideas, and why is the government and why are voters not hearing anything about them from the old system? If they exist, they're not being heard about, and there's a question mark about whether they even exist at all. So I thought it was interesting just to throw Cummings in, because whatever you think of Dominic Cummings, he does understand voters and how they think. I hope that sort of short 10 minutes or so was helpful. Do subscribe if you find these updates and presentations helpful. And as I say, trying different forms of content this year. But I really wanted to focus this one in on the disconnect, which I think has got broader and wider and was exposed last week between what the government's kind of reality and what it wants to push is, and the reality that voters and the public are experiencing on the ground, and that those in the NHS themselves, working in the NHS, are experiencing on a day-to-day basis. I'll leave it there and just say thank you very much. All comments and feedback, as always, is very, very welcome. And yeah, thank you very much.